Hi, there are 5 mistakes people with epilepsy have that make their seizure worse and do not improve. And I will mention them all. The number 1 mistake, which is not taking anti-seizure medications consistently on time and missing them. So the recommendation is to be consistent on medications morning and night, or however the doctor prescribes you, and to make sure that you do not have missing days or doses. And this is very, very important. The second mistake is not having the appropriate seizure medication for the appropriate anti-seizure syndrome. So epilepsy has multiple different types, and there are 2 major types: the focal epilepsy, when seizures are coming from one spot in the brain, and the second one is generalized epilepsy, when seizures are coming from all over the brain. And in this case, we have a treatment that works for focal epilepsy, and if you give it to generalized epilepsy, it can get things worse. So it is important to know what type of epilepsy you are treating. And the third mistake I see, which is not increasing the anti-seizure medication high enough dose so that the patient will not reach the full dose that they need to improve their epilepsy. So for example, I've seen many patients, they start like Keppra 500 milligram twice a day, seizures continues, and then they will not push up the medicine higher, and then we'll go to the second medicine, and then they will have a seizure and on low dose of that medication, and they will add a third medication. So it is most importantly to just give enough medication and keep increasing the dose until we reach the maximum dose, and then we can switch to the third medication or second medication. And I'm here at the Al-Aqsa Mosque in Jerusalem, Palestine, and this is a very nice holy place. And the other mistake, which is not following consistently with the neurologist, and sometimes they are followed by a neurosurgeon or psychiatrist or someone else. This is best important to make sure you follow with a neurologist that is specialized in epilepsy and neurology, so that he can treat your seizures the best. There are multiple causes and ways to treat epilepsy, and for all of them you can see this video for all the details. And stay healthy, and see you in the next one. Salam.